10 minutes before the hour and there is a bustle of activity. Students are on their way to class and the campus is alive once more. Last year it didn't seem like a scene like this would be possible. Since the coronavirus was first detected in the US in February 2020, it has devastated the nation. Last semester, Radford's entire campus was put online, and students had to study in their dorms in isolation. Now, university life is slowly getting back to normal.
My name is Kaylee Rakes.
And Michaela Steele.
Okay, it's nice to meet you. So have you guys got any online classes this term?
Not this year, no.
Oh, okay.
No, I don't either.
But did you have some last year?
Yeah, a bunch.
Yeah, I had a bunch too.
Yeah.
How did you find that?
I withdrew from one of them because I just couldn't get the grasp of it because it's science. But the other ones went smooth.
Do you feel like you're getting full access to your degree and to university life despite the restrictions?
Oh, absolutely not. I feel like it could be so much better than all of this.
Oh, no.
Definitely.
Yeah.
No, that is hard. How's the experience been now that you're back on campus?
That's great. This is better than last year.
Yes,
by a lot.
because everything's a lot more open and like people are
more alive,
it.
you know.
Yeah, and there's so many more people out than like the last semester and everything, so it's really nice.
Oh, that is great. Well, thanks for having this interview, guys.
Thank you.
Thank you.
Fanny Cheval is an international student. For a while, she wasn't sure if this trip would be possible. Thankfully, travel restrictions into the US were lifted just in time for her to secure her visa and travel abroad for her education. Fanny spoke more on her experience crossing the border during these difficult times.
Hi, so it was a stress period because to get the visa it's really difficult when we are not in the COVID period. So in the COVID period it's more difficult, and especially because I needed the national and tourist exceptions to come in America. But all was good and I can get my visa, so it was a stress period, but okay.
What happens if COVID cases get worse here? Do you think you'll have to go home?
Yeah, I think so. I hope it will be okay, but it will be, I think, my choice to go home because it's more safe to be in your country when there is more difficulties because of the COVID.
According to the university's statistics, there are currently 6,836 students taking in-person classes, which is the majority of the student population. But the university haven't let students return to in-person lessons without protection. They have placed a number of regulations in place to protect students and staff. Dr. Susan Tragesser, COVID coordinator at Radford University and Vice President of Student Affairs, explains more. Hi Susan. So what are the restrictions Radford University has put in place to protect its students and staff? And when do you predict these restrictions lifting?
So this semester, or going into this semester, the university reversed or rolled back a number of the specific protocols and guidance that we had related to COVID-19 for the previous academic year. Some of those things that we rolled back were specific entrance and access and egress points for each building, 2-person limits on each of the elevators, as well as physical distancing in our gathering spaces as well as our classrooms across campus. For this semester, the protocols that we've had in place, we did have to put in place indoor masking based off of guidance from the CDC as well as the Virginia Department of Health and specifically the New River Health District. So we do have the indoor masking in place. We also have a vaccine requirement, a COVID-19 vaccine requirement for both our students as well as our employees. And partially or unvaccinated members of our community do have to test weekly.
Okay, so what should students do if they suspect they might have COVID?
So if a student thinks that they might have COVID-19, it would be really important for them to contact Student Health. If they're here on main campus, or the nurse navigator if they're on the RUC campus, and to let the team member at Student Health or the nurse navigator know that they have symptoms and that they would like to have an appointment. And so the staff will help them get scheduled.
Oh, thank you.
It would also be important for them to contact the Dean of Students office to let them know that they're not feeling well so that they can receive an absence notification and communication with their faculty members.
Okay, yeah, that'd be very useful. So what is the university protocol if a student is tested positive for COVID-19?
Yeah, so if a student has tested positive for COVID-19, then they would be required to isolate for a period of at least 10 days. And that 10 days is determined by whether it's either the date of symptom onset or the date of the positive test in the case of a student that is asymptomatic. If a student actually lives in one of our residence halls here on campus, then we do move them to the university's isolation and quarantine housing, which is at an off-campus apartment complex. And then if they live in one of our university-owned or operated apartments, or they live off campus, we guide them on the appropriate way to isolate in that space.
Okay, cool. So what is the university doing to ensure that students have full access to their degree and wider aspects of university life despite the COVID restrictions?
Absolutely. So with moving into this academic year, we've remained really committed to making sure that we're providing the in-person experience that our students want and need to continue on their journeys and to make sure that they're being successful in the classroom as well as outside the classroom. And in doing that, we've maintained some of the COVID protocols that we had in place previously and continue to review the guidance provided by the CDC, the Virginia Department of Health, and the Commonwealth of Virginia to make ongoing adjustments to our health and safety protocols as we need to. Some of the other things that we're doing is making sure that as we're working with our student organizations, as we continue to work with our amazing faculty members, creating those opportunities that when it's appropriate, so if a student has to go into isolation, working with their faculty members to make sure that if the student feels well enough to continue to participate in class, they have the opportunities and the access to be able to do that. Whether it's getting the information through D2L or whether it's participating in class via Zoom. The same thing with student events. Any time or any way possible, we're holding events outside since the weather's still so nice, so that folks can come and engage and hopefully have a little bit higher comfort level around the participation because they're outside as opposed to a more crowded indoor space. And so for events that are indoors, we're encouraging our student organizations and certainly other departments on campus as they're planning to make sure that there's a virtual opportunity for students to engage as well whenever possible.
Despite these measures, the campus is not entirely COVID-free. There were 5 new positive tests this week, 4 of which were students, 1 being an employee. This demonstrates a decrease from the 16-case spike the university experienced at the end of August. Last week, the percentage of students fully or partially vaccinated was 82.8%. The number of employees fully or partially vaccinated was 90.6%. Meaning that the majority of the university community has protection against the virus, which still continues to devastate Virginia. Radford's Mayor Horton warned residents of the importance of following restrictions to protect the city from the virus.
The hospitals are packed right now. You're probably seeing stories regionally and nationwide where folks are talking about the fact that it's tough right now for our first responders, it's tough for our medical workers. We want to keep them in our thoughts and in our hearts because this is a very difficult time. Many of the folks, primarily who are not vaccinated, although there are some breakthrough cases, many of the folks who are not vaccinated are having a really, really difficult time. I don't want to make a huge political issue out of this, but I am hopeful that we can move beyond this in the coming weeks and months. The best advice that we have from our medical professionals, from our health department, is if you have not yet been vaccinated, please consider that as a protection for yourself, for your family. And we are encouraging folks to mask. Here within the city spaces, we are requiring masking, and that is for the safety of our employees, that is the safety of our citizens. We are trying to limit the spread of this horrible disease.
At the beginning of October, Virginia had 2,780 reported cases, bringing the total case count up to 869,328. While these case numbers still need to be reduced, they show a decline from the spike in cases towards the end of August. There were 3,487 new cases and 32 new deaths. Melissa Gordon from Vaccinate Virginia explained that it is likely that several factors contributed to this increase in cases towards the end of August. She explained that as the more transmissible Delta variant emerged in the US, people began to change their behaviours. Due to the low case count earlier this summer, people chose to travel more and engage in more in-person activities. Mask requirements and capacity limits were relaxing in many settings around that time. In some settings, prior to the emergence of the Delta variants, masks were no longer required for fully vaccinated persons. Furthermore, with cases already trending upwards, many younger persons returned to in-person education in both K-12 settings and institutes of higher education. It was these factors that likely contributed to the increase in cases seen towards the end of the summer period. The Centers for Disease Control and Prevention warns against the new Delta variant, which is more infectious than previous strains of the virus. The Delta strain is currently the predominant variant of the virus in the US. It can cause twice as many infections and is reported to cause more severe illness. Everyone can spread the Delta variant, including those vaccinated individuals, although the CDC does note that vaccinated people appear to spread the virus for a shorter time. So while life may seem to be returning to normal, it is important to remember that the coronavirus threat remains. Radford University urges their community to be vigilant in controlling the spread of the virus. While this year hasn't been easy, there is still a lot more to be done before life can return to normal, COVID-free. This has been Eloise Sumner reporting at Radford University. Thank you.